This presentation is on surviving an acute ischemic stroke. Raise your hand if you know the answer. What are the signs and symptoms of stroke? And secondly, how long can brain cells survive without oxygen, which can occur when someone has a stroke? And the answer to that one is, on an average, about 6 minutes. And in regards to signs and symptoms, that will be discussed later in the presentation. The goals and objectives for this presentation is for early detection of signs and symptoms of stroke, and that will help ensure optimal outcomes. The administration of tissue plasminogen activators, which helps prevent stroke-related disabilities, and the administration of antiplatelets and anticoagulants, which help reduce risk of recurrent strokes. The objectives is by the end of this presentation, students will be able to explain the importance of early detection for the signs and symptoms of stroke, identify key components of reducing disabilities related to acute ischemic stroke, calculate the correct dose of alteplase for treatment of acute ischemic stroke, and list standard protocols for administration of alteplase, antiplatelets, and coagulants. There are two types of strokes. There's ischemic stroke, and the second would be a hemorrhagic stroke. If you look at the picture that states block, this is a type of stroke in which a clot is blocking the blood vessel within the brain. And the blockage decreases the brain's blood flow and causes damage to the affected brain cells, as you can see there with the blocking of that vessel. The second is hemorrhagic stroke. And a hemorrhagic stroke occurs when there's a bleed of an artery within the brain, and the pressure of that leaked blood causes damage to surrounding brain cells. Signs and symptoms of stroke. The best way to remember the signs and symptoms of stroke is to use the acronym FAST, F-A-S-T. And the F stands for face, the A is for arm, S is for speech, and T is for time. I took pictures of a mobile app which is called Stroke Test, and that is the icon in which the app looks like, where you see the man holding his head. The second one is the face, and the third one is showing you the arms, and then the fourth is speech, and the last one deals with time. So if you answer no to any question in regards to your smell, arm drift, or speech, then you will get that icon at the very end showing that you need to contact an ambulance or 911 as soon as possible. So let's see which goes with which. So face, would it be A, B, C, or D? And the answer is D. And you have the patient smile and see if one side of the face is drooping. For arm, the answer is C, and you're looking for weakness in extremities, whether that be the arms or the legs. You can have your patient hold their arms out and see if one arm drops or if they're able to hold a small object in the affected arm. And then S, which is speech. The answer for that is B. They can have slurred speech, difficulty talking, things of that sort. And then the last is T, time, which is A, time to call the ambulance. If they have any of those signs or symptoms, you need to get them to the hospital as soon as possible. Alteplase. Alteplase is a treatment used to break the clot up within the brain so that perfusion can be restored within the brain. It is recommended for patients that have acute ischemic strokes, and they want you to have that patient with this treatment within onset of signs and symptoms less than 4.5 hours. That's why it's very important to recognize the signs and symptoms as soon as possible and to get medical attention as soon as possible. Oxalase is given intravenously, and again, it dissolves a clot. And then once the clot is dissolved, this helps for brain perfusion to start again. And in some instances, it helps to minimize brain cell damage. There are some monitoring requirements in regards to administering oxalase. Some of the things you need to do before giving this medication is a head CT. You need to make sure that this stroke is not a bleed and that it is indeed a clot causing these disabilities from the stroke. Secondly, you would want to draw labs, get coagulants, get platelet count and glucose levels. You want to get the clotting factors for that patient, because if they have a high risk of bleeding, like if they have a low platelet count or their coags come back as if they will have instances of bleeding, then you don't really want to give this medication because the risk of bleeding will increase. And then you want to also know their glucose levels, because if they're drowsy due to maybe having hypoglycemia, you don't want that to interfere with your neural checks, which brings me to the other requirement, which you have to give the patient a stroke score. And this stroke score lets you know the deficits that patient has. And you get a baseline before giving this medication to make sure that the patient stroke score doesn't get worse after the administration of the medication. And then the following should be done before and after. You need to make sure you monitor their vital signs, keep tight controls on their blood pressure, especially again because hypertension can cause a bleed. You want to definitely continue to do your stroke score, and you also want to look at their level of consciousness, and you want to make sure that doesn't change. Quiz time. So you need to calculate how much oxalase a patient would receive. So your patient was admitted with the diagnosis of an acute ischemic stroke. The patient met all the requirements after all of the pre-screenings were done, and the doctor orders for that patient to receive oxalase. And your patient currently weighs 220 pounds. How much oxalase should the patient receive as a total dose? Not the first bolus, but the total dose that they should receive in milligrams of oxalase. And the answer to that is A. They should receive 90 milligrams total of oxalase. The answer C is incorrect, but you will give a bolus of 9 milligrams before you start to administer the remaining amount over an hour. Our next topic of discussion is aspirin and low molecular weight heparin. And these are two things that is a standard treatment for prevention of recurrent acute ischemic strokes. What is aspirin? Aspirin is the drug class known as nonsteroidal anti-inflammatory drugs, also called NSAIDs. NSAIDs have some chemical differences, but all of them are used to treat pain, fever, and inflammation. NSAIDs are also known to increase the risk of bleeding due to their ability to prevent blood clots. Aspirin is used in acute ischemic strokes. Acute ischemic strokes are also known as cerebrovascular accidents, CVAs. This occurs when a blood clot is lodged into the blood vessel of the brain, causing blood flow to be decreased within the brain or causing no blood flow at all. Aspirin is an antiplatelet, and it has the ability to help or to stop these clots from forming so that they don't become lodged into the brain's blood vessels. Comparison of the two drugs used in the treatment of ischemic strokes. The two that we're looking at is aspirin and low molecular weight heparin. The mode of action for aspirin is that it inhibits certain chemicals, and one of those is the thromboxane A2, a vasoconstrictor and a stimulator of platelet aggregation. It also inhibits prostaxylin activity, in which also inhibits platelet aggregation. The mode of action for low molecular weight heparin is that it reduces the growth of thrombin, and that helps to prevent the formation of fibrin, which also decreases chances of clots. The drug interactions with aspirin would be anything that would increase bleeding, such as NSAIDs or anticoagulants. And that would be the same for the low molecular weight heparin. You don't want to give that drug with any additional anticoagulants or NSAIDs, as that too will increase your chances of bleeding. Aspirin has been shown to be efficient in the prevention of recurrent ischemic strokes, whereas the low molecular weight heparin has shown to be efficient in preventing venous thromboembolism after ischemic stroke. Aspirin is a relatively safe medication to give if not given with other medications that will increase its risk of bleeding. Low molecular weight heparin is safer to give than unfractionated heparin in that it has a lower risk of developing heparin-induced thrombocytopenia, also known as HIT. The cost of aspirin is pretty inexpensive. You can get it over the counter, and it's less than $10 a bottle, whereas the low molecular weight heparin is significantly more expensive, with the cost of one dose being about $24.34 a dose. Your expected outcome with aspirin is to reduce the recurrent ischemic strokes, and the expected outcome with the low molecular weight heparin is to prevent venous thromboembolism after ischemic stroke. Acute ischemic strokes are the leading cause of adult disabilities, and it's the fourth leading cause of death. By identifying the signs and symptoms of acute ischemic stroke, patients are able to expedite their treatment with alteplase, and in doing so can possibly reverse the harmful effects of the stroke. The use of aspirin has shown to reduce recurrent acute ischemic strokes, and additionally, a low molecular weight heparin will aid in preventing venous clots. Aspirin and low molecular weight heparin will reduce patients' risk of repeated strokes and increase their chances of optimal recovery. Your next slide will show you a visual explanation of both strokes, ischemic strokes and hemorrhagic strokes. Thank you.